So it is 7 o'clock. We're getting ready to start our live broadcast. Going to wait for a few people to join in. I think there was a couple people that were going to be late. So we'll give them a minute or two to get caught up. Shouldn't be very long. As you can tell, this is our first time on a Google Hangout. So hopefully this will go smooth. We were having a little bit of a problem with the group chat a little bit earlier. We'll see if that works. If not, what we can do is, if you want, you can post a question to our Facebook page. You can go to Central North Carolina's Diabetes Support Group, and then we'll take our questions from there. So see, we've got a few more folks that are coming in. My name is Dr. Ron Adams. This evening, what we're going to be talking about, obviously, is diabetes. Not only about all the statistics, you guys already know those, so I really don't see any reason to cover that. That was pretty quick. So I guess without much ado, I've been in private practice for the last 15 years. Started dealing with more of the chronic conditions over about the last 10 years of that. What I noticed is there was a lot of folks that were being predominantly mismanaged, put on a lot of medications, things weren't being changed, the blood sugar was still out of control. So the more I got into functional medicine, the more I found out that I had a pretty good grasp on being able to find and fix these types of conditions. It became almost second nature. The hard thing for me was to find out what motivated people, what motivated them to change to where they wanted to, change their life, change their habits, basically get out of the rut that created this condition. So a lot of the people that I deal with are, their goals are pretty straightforward. They want to be able to sleep through the night. They want to go to the bathroom less often. They don't like to have to do the finger sticks. They want to eat a fairly normal diet. Will take less medications. They want to be able to play with their kids and their grandkids. So pretty simple goals overall. So with talking with these folks, what we started finding out was that, they were ready to make a change. It was just that the way that they'd been treated over the years was take this medication, improve your diet without any instruction on the diet, and that was pretty much it. So that's really when we started to get more involved with folks with type 2 diabetes, and that's what we're going to predominantly talk about tonight is type 2. So how does it start? Well, the progression of diabetes is pretty straightforward. Usually what happens is the client goes to their doctor and gets the annual physical, and they get the blood work, and they're told, well, your glucose was elevated or your A1C was elevated. You're not diabetic yet, or you're what's called pre-diabetic, and we're just going to wait and see. In my book, pre-diabetes is like being kind of pregnant. You either are or you're not. Typically what these folks are is what's called insulin resistant. Insulin resistance is kind of what it sounds like. Insulin, think of it like a key that's there to open up a lock. What will happen is the cell won't recognize that key. Now, why does that happen? Well, the cell itself is just a stationary thing. We're talking predominantly about muscle cells when it comes to blood sugar metabolism, but the receptor site gets blocked by usually fat or inflammation, a lot of inflammation. So what happens is when insulin comes in, tries to open up the cell because the sugar is just flowing through the bloodstream and it's not being absorbed, and the cell can't open up, so the blood sugar just keeps increasing and increasing and increasing. So what happens is folks start noticing more frequent urination. They'll start getting thirsty all the time because the body's trying to purge all the sugar that's happening in the system. So looking at insulin, because it is a hormone, you have to go backwards and say, all right, what stimulated this release of the extra insulin? Well, the brain detects when sugar levels fluctuate, sends a chemical message through the bloodstream, different tissues pick it up. One of those tissues is the pancreas, the other one is the liver. The pancreas is what produces insulin, so insulin released from the pancreas goes through the bloodstream. The liver has a role in that, and this is how it's processed. So once this process starts, if the blood sugar doesn't go down, again, more insulin is released, and hence the term insulin resistance. So what I look for is somebody that has had blood work, but doesn't really understand the blood work most of the time because the blood work hasn't been complete. So they'll order an A1C and a glucose and maybe a triglycerides and cholesterol panel. They don't look at anything else. We also want to look at what's happening with the gut. The gut plays a huge role in sugar metabolism. You think about it, what we eat is where we're getting that sugar from. If somebody has a problem with the gut, let's say, for example, leaky gut, they're going to allow the permeability of the stomach increases. In other words, more larger than normal food particles, or a lot more glucose gets through the lining of the intestine, and that's where we get that absorption. So with leaky gut, what happens is we're bombarding the system with things, especially the bloodstream, that things that really aren't supposed to be there in that size. So with leaky gut, again, that can contribute to the way that blood sugar is entered into the picture. Inflammation. Glucose tends to increase inflammatory processes. Now, I want to talk about the brain for a minute. Your brain controls every aspect of the body. If blood sugar starts to elevate, that's a very unfriendly environment for the brain. What we found out quite a few years ago is that the brain also has cells that produce a small amount of insulin to try to control that glucose. But every time your blood glucose goes over 127, what happens is it's damaging cells. It's damaging neurons, which are obviously the brain cells, and they're the ones that allow us to do our day-to-day function. So what if it's a brain cell that controls your heart rate? Or what if it's a brain cell that controls facial expression? Or what if it's a brain cell that controls the pancreas, which is what's releasing the insulin? Then we have this large catastrophe. You know, you think about it, your brain only takes up 2% of your body's mass, but it requires 30% of the oxygen and 30% of the glucose that we take in. You change that balance or mess with that balance, and then things start breaking down. So we want to keep an eye on that. Some of the things that folks notice with blood sugar problems is they start having a hard time with processing. Short-term memory goes away. It's one of the lowest priorities the brain has. So you walk into a room and you forget why you walk in there, or you set your car's keys down somewhere and you can't remember where you put them. It's not a sign of old age. It's telling you that the brain is under duress, and blood sugar can definitely have an impact on that. Let's talk about the circulatory system. The more blood sugar we get, the more inflamed we tend to get. That's why folks will start noticing things like diabetic peripheral neuropathy, numbness or tingling in the hands or in the feet. They'll start noticing changes in sexual function. Blood sugar is also important with hormone regulation and hormone production. So let's talk about the thyroid. Your thyroid gland is located right here at the base of the neck, and it regulates almost all hormones in the body. And like I said earlier, insulin is a hormone. So if the thyroid starts to misbehave, for lack of better terms, then again, we can have a problem with metabolizing blood sugar. We're going to talk about the elephant in the room, weight. Now, for a long time, people were told, well, if you gain weight, eventually you're going to become diabetic. What we know now from the functional side is that sometimes the diabetes comes first because we can't process all that sugar. So what the body does is it wants to store it. So what it'll do is it'll store it in adipose cells, or which is called fat cells. So the weight can come on as we enter into that insulin resistant state. And as we add more weight, we have to add more vasculature. It's a process called angiogenesis, and then the system has to work a whole lot harder. So weight sometimes comes after the blood sugar regulation problems. And yes, it does sometimes come prior to that, but it's not always the case. So looking at what's happening with gut function, looking what's happening with brain function, look what happens with the circulatory system, with the thyroid. We're going to talk about adrenal glands. Most of the folks that I see with diabetes or that I talk to typically have a hard time sleeping. Well, blood sugar regulation plays a huge role in that. When we go to sleep, we're in a fast, so we're not getting the fuel in the system. So what happens is there's a trigger that's tripped, and the adrenal glands, which is our stress glands, they will start to help meter out sugar throughout the evening. Well, when the demand for sugar starts to increase, what will happen is the adrenal glands will start to release more cortisol. Now, cortisol is what wakes our brain up in the morning, and when the levels go down, it's supposed to put us to sleep at night. But a lot of times with folks with insulin resistance or diabetes, 2 o'clock in the morning feels like 2 o'clock in the afternoon, and vice versa. that blood sugar level starts to change. The adrenals kick into gear. We release a lot more cortisol, again, a hormone, and then we wake up. We start moving around. We may get up, watch TV, or may go get a snack. You get that snack, and all of a sudden you fall back to sleep. Problem is, when you wake up in the morning, and if you're already diabetic and they've already given you that test kit, what you're going to have to do is stick your finger and check your blood sugar, and guess what's going to happen? That blood sugar level is going to be elevated. So, excuse me, we want to make sure that we can keep our blood sugar at a pretty consistent level throughout the day and throughout the night. So how do we do that? Well, a lot of times folks will say, well, I'll increase my medication or I'll decrease my medication. That's kind of a poor way to manage it. It's kind of like a dog chasing a car. The dog does not know how to lead the car, so it's never going to catch up. So what I'll typically recommend folks is, obviously you want some proteins, you want some carbs, not a whole lot. You want some, simple sugars like your fruits. So on your plate, get a good healthy portion of protein. Fish, chicken, lean meats, things like that are a good protein. If you're a vegetarian, you've got your legumes that you can do, beans. A lot of your vegetables have protein in them. A lot of your vegetables are, carbohydrates. Watch your potatoes, watch your rices. Those are heavy starches and carbohydrates. The old standard from the American Diabetes Association was, count your carbs, stay away from the carbs and stay away from fat. Well, fat actually breaks down into sugar slower than carbohydrates do. Carbs break into sugar a lot quicker. So you can have some fats in your diet. You want to eat consistently, but not gorge yourself. If you're full, don't eat, but, get a good healthy protein for breakfast. Mid-morning, if you feel like your blood sugar is starting to fluctuate, get a good snack. Again, something protein, maybe some almonds, some cashews, something like that. Lunch, again, you want some protein, some carbs, maybe some fruit with that. Get some simple sugars in there. Same thing in the afternoon. If you feel like the blood sugar is starting to fluctuate, maybe a snack. Don't be bashful about eating, but at the same time, don't gorge yourself. If you feel stuffed, don't eat. If you feel full, that's the brain telling you something. In the evening, have a good meal. And I usually recommend for my patients with diabetes or blood sugar regulation problems that they have some sort of snack before bedtime, and typically higher protein. Protein breaks down into sugar a little bit slower, so it's going to give a more consistent, slow release throughout the night. So they're not going to have that waking up at 2 or 3 in the morning. Those are pretty simple guidelines. It's a little more complex with a lot of our folks. A lot of people that I see are typically chronic, hence the name of our clinic, which is Chronic Condition Centers of the Carolinas. We're looking at those folks that have had this, 3, 4, 5, 10, 15 years and just haven't been able to get a good grasp on it. So one of the things that I will recommend is we get a good complete blood panel if they haven't had one, because we want to look at everything body system by body system. The more we understand of which systems are being affected, the better we can help you. So lab-wise, I'll look obviously at glucose and A1C. We want to see where that is. Now in the county that I am in, if the A1C is 6.4 or higher, you're in a diabetic category. The CDC says that you do it by demographic. So sometimes counties are different. One county over can be 6.2 or it can be 6.5. It just depends on where you're at. So we'll look at glucose, we'll look at A1C. Ideally, I'd like to see the blood sugar between 85 and 99. Anything above that, obviously we're in a danger zone. When it gets to that 127 mark or higher, then they'll say, well, you're diabetic, even without an A1C, if they just run the glucose. We're going to look at what's happening with the kidney. Want to see what's happening with uric acid. Yes, if uric acid is elevated, that could indicate gout, but also elevations in uric acid can mean insulin resistance. BUN stands for blood urea and nitrogen. Again, it's a kidney function test. And then creatinine. If creatinine is elevated, that could tell us that the kidneys are in failure. There's different stages, 1 through 4. We'll look at what's happening from an electrolyte perspective. Want to make sure that we're absorbing nutrients well. Want to make sure that somebody's well hydrated. Hydration is important. A good rule of thumb is whatever your body weight is, divide that in half, and that's how many ounces of water a day you should be drinking. Now, there's some exceptions to that. If you're on a diuretic or you have a fluid retention problem, obviously you're going to want to consult your physician about that. But we definitely want to keep as much water in our system as we can. That's what it helps with blood volume. That's what flushes the kidneys. It's what we run on. We're about 70% water, so we want to make sure that we get it in our system. Look at what is happening with iron balance or iron levels, anemias. And we see a lot of folks with anemias with type 2 diabetes and with insulin resistance. Why is iron important? Well, it's an oxygen transportation system. Your heme groups or your hemoglobin is what carries oxygen through the bloodstream. If we see an anemia, that's going to be somebody that's typically going to be fatigued. And we don't want to see that. Before I forget, I did want to mention all those folks that are attending the webinar this evening. I'm going to offer a free gift at the end of the webinar. So hold tight. It's going to be a good one. I think you'll like it. Blood-wise, we're also looking at things like your B12 levels. Now, if B12 is low, it doesn't always mean that you need to go out and get a shot. What a lot of times that tells us that the health of the gut is not there. The gut produces what's called intrinsic factors, which helps us process B complexes. So you're looking at things like MCV or MCH, mean corpuscular volume, mean corpuscular height. Look at red blood cells. The health of red blood cells is important because, again, it's part of the transportation system. Our immune system, huge player in diabetes. If we have any kind of autoimmune condition, type 1 diabetes, by the way, is an autoimmune condition. The immune system has attacked the pancreas, damaging it to the extent where it can no longer produce insulin. Those are the folks that have to have insulin by injection. But we want to make sure that the immune system isn't flared up for some reason, or if there's some sort of acute infection or a chronic infection. So we'll look at white blood cells, neutrophils, eosinophils, monocytes, to keep track. Is the immune system doing what it's supposed to? Is it protecting us? It's the barrier system. Just like we have 4 barriers. We've got the gut barrier, the lung barrier, the skin barrier, and then the blood-brain barrier. We want to make sure those are intact so we don't have things in there that shouldn't be. We're going to look at the health of the liver. Triglycerides. What are triglycerides? Well, they're branch chains of sugar. So when we start seeing triglycerides elevate, typically we're going to see obviously somebody that has higher blood sugar. Cholesterol. Cholesterol is not a bad thing. So many people are afraid of cholesterol because we see so many commercials on TV about the statin drugs or cholesterol lowering drugs. Your cholesterol is essential for the health of the nervous system. Your sensory nerves are wrapped with a substance called myelin, which is made up predominantly cholesterol, and about 30 to 40% of your brain's mass is cholesterol. So if we take something that's there to strip cholesterol out of the system, what's going to happen? Well, we can lose mass in the brain, and that's something that we see with folks with Alzheimer's. So we don't want to do that. It is produced by the liver, so that's why we check cholesterol, triglycerides, LDL, and HDL. We've always been told LDLs are the bad cholesterol, LDLs are the good cholesterol, or the other way around, I'm sorry. LDLs are bad and HDLs are good. But those are carrier proteins. They're a low density and a high density lipoprotein, and they carry things throughout the bloodstream. One's going to and one's going away from. So it comes down to quantity. When the LDLs are going up and the HDLs are going down, there's a problem going on. I'll look at thyroid function. What's happening with TSH levels? What's happening with T4, T3? Your TSH is thyroid stimulating hormone, which is produced by the pituitary gland in the brain. When it starts to elevate, that typically tells us that the thyroid is slowing down in the production of T4 and T3. This isn't the thyroid workshop, so I'm not going to go in great detail, but T3 is the hormone that turns everything on and turns everything off from the thyroid. So we pay attention. We run T3 uptake, free T3, free T4. We'll look at resin T3 and then T3 uptake. We'll also look at the thyroid antibodies. I see folks that'll come in, they'll have blood sugar problems, they'll have fatigue, they'll have weight gain, they'll have hair loss, they'll lose the outside thirds of their eyebrows, and come to find out they have an autoimmune thyroid condition called Hashimoto's. A lot of those folks we see, they do have blood sugar regulation problems. They're going to be either insulin resistant or sometimes the blood sugar is too low, which is hypoglycemia. So looking at that is important. We'll look at vitamin D levels. Vitamin D is essential for cell health. We're going to look at the inflammatory markers, things like homocysteine and C-reactive protein. If those are elevated, that means we have inflammation, possibly systemic-wise or in the cardiovascular system or even in the brain. We want to see those levels stay at a good range. This blood panel is what's called outside of standard of care. The reason for that is I run it because I want to find out all the pieces of the puzzle. Like I said earlier, it's fun to find and fix what the problem is, but if you can't do the investigation, if you can't dig deep, how are you going to know? So looking at that lab panel is extremely important. So it gives us all the pieces of the puzzle. Now, earlier on in the webinar, I was talking about the chat function. I'm not sure if it's working or not. If you do have a question, what I would recommend is go to the Facebook site, which is let me pull it up here real quick. It's Central North Carolina Diabetes Support Group. You can post a question on there. We'll have about 10 minutes and we can cover any questions anybody has. If you want to try to type it in the chat function, I'll see if we can pull that up, and hopefully we can get some conversation going. In the meantime, if you are unable to post on the chat, what the gift that I'm offering for folks that have attended the webinar is a free 15-minute consultation. We'll review your health history. If you've had any labs that have been done within the last 90 days, we'll take a look at those also. And what we can do is find out what's going on with you, maybe give you some tips. Maybe it takes a little bit more work, but we're offering that to anybody that would like it. The website that you want to go to is ccofcarolinas.com. That's CCOF Carolinas with an S.com. You can request your consult there. It is free. It's no charge. It's 15 minutes on the phone with me, and I will review the lab. So looking over here at Facebook real quick, I'm not seeing any questions yet. If you're unable to get on the Facebook side, you can send your question in via the web page the website that I gave you. It's a landing page, so you can just enter your information in there and then we'll get in touch with you. I hope everybody learned something. I hope it was informative. We're going to be doing more of these. I think part 2, we're going to probably dig a little bit deeper into what the labs mean. So hold on for that. I'll probably post that on Facebook also. So I hope everybody enjoyed it. We're pretty much on track for time. Let me just check Facebook one more time, see if we've got any questions, and it doesn't look like we have. So apparently I did a good job. So I hope everybody has a great evening, and I look forward to seeing you on the next webinar. This is Dr. Ron Adams from Chronic Condition Centers of the Carolinas, and I appreciate your time.